This is Serena from Pinnacle. Thank you for joining us today. On the line with us, we have our friends from UnitedHealthcare. This webinar, it is a national webinar, so we are going to start off talking about dual special needs plans in general, and United's set up with that and their HRA, and we'll go into that. Towards the end of this webinar, we'll get a little bit more regional and focus more in the Connecticut area, but we'll let you know when that's coming. So if you're not interested in listening towards that, you'll be able to drop off at the end, but the good chunk of this will be a national level. And with that, we'll have Jessica kick us off and get this going for you.
All right, well, good afternoon, everyone, and welcome on into our D-SNP training here. My name is Jessica Sullivan, and I'm one of the trainers with UnitedHealthcare's Field Sales Training Team. Now, our training today is all about understanding the basics of a dual special needs plan. And this is a type of a Medicare Advantage plan for people who qualify for Medicare and the Medicaid program. Today, I'm going to provide you with some information on how to sell these health plans for special needs consumers under UnitedHealthcare. And then, as Serena mentioned, later on in the presentation, we will transition with more of a focus on D-SNP plans available in the Connecticut market. So today in our training, we are going to cover the basics of a D-SNP. From there, we're going to take a look at the D-SNP enrollment process. And with the D-SNP enrollment process also comes something called SSBCI, which you may be familiar with. So we're going to talk a little bit about SSBCI as we go throughout today's presentation. From there, we'll take a look at some marketing strategies and how you can start connecting in your local market. Lastly, we're going to wrap up with tools and resources to support you and your members. Now, after our tools and resources, that's where we're going to take that transition and we're going to switch gears and go into D-SNP specific plans in Connecticut. But first, we're going to walk through some of the basics of a 2026 UnitedHealthcare D-SNP. Dual eligible refers to a consumer who is eligible for both Medicare Part A and Part B and Medicaid. Consumers who are dual eligible may face some unique challenges. While the concerns of each consumer are unique in general, dual eligible consumers feel that their greatest concerns are maintaining a certain quality of life, balancing complex health issues and financial hardship, being as healthy as possible, navigating the healthcare system, and communicating with and being understood by their plan provider. Now, you and UnitedHealthcare can help address these concerns by providing benefits that help members maintain their quality of life and promote good health, by simplifying the process of accessing care, and by educating consumers so that they are aware of their available D-SNP benefits. Now, today we're going to dive into how you can try and help those with these concerns and more. We continue to invest in the benefits that matter most to consumers and support key social determinants of health with all of our D-SNP plans. Our D-SNP plans are designed to support the full spectrum of Medicaid eligibility, whether they're a full dual eligible member or a partial dual eligible. This includes access to our OTC or over-the-counter benefit, plus healthy food and utilities for SSBCI qualifying members, providing members the flexibility to use their credits on what matters most. And new for 2026, D-SNP members can use their OTC benefit on wellness support items, and we're going to talk more about that wellness support later on a later slide. D-SNP members, they're going to receive a U card, which will allow them to easily access their OTC benefits. Now, to get a clear picture of this 2026 D-SNP plan design, let's discuss some of the changes we've seen in the Medicare space. The Medicare Advantage Value-Based Insurance Design, or VBID model, which helped provide members with tailored supplemental benefits. That ended December 31st of 2025 per the Centers for Medicare and Medicaid Services. Now, the good news is that plans can offer most of the same benefits, such as non-primarily health-related healthy food and home utilities. And this is through another program called Special Supplemental Benefits for the Chronically Ill, also known as SSBCI. These are benefits offered through Medicare Advantage plans to individuals with complex chronic conditions. SSBCI is designed to support individuals with serious chronic illness, provide non-primarily health-related benefits that can help maintain or improve a person's health or overall function, and to address social determinants of health, such as access to food, transportation, and home modifications. Now, SSBCI is considered a positive development in healthcare for several key reasons, especially within the Medicare Advantage framework. SSBCI allows MA plans to offer non-medical services tailored to the unique needs of chronically ill individuals. This flexibility enables plans to address social determinants of health, which are often critical to managing chronic conditions effectively. These services include things like healthy food benefits, as well as transportation. For improved outcomes, by addressing factors like nutrition and mobility, SSBCI can help reduce hospitalizations, prevent complications, support medication adherence, and enhance overall quality of life. SSBCI benefits can be offered non-uniformly, meaning plans can target support to those who need it most. This helps reduce disparities in care for vulnerable populations with complex health needs. Now, in order to qualify for SSBCI benefits, members must meet and have one or more qualifying condition, which we'll look at in a few slides here. Eligibility to SSBCI, it is not based off of their income or low income subsidy status. Plans are required to validate that members of the D-SNP plan have at least one of the eligible chronic conditions in order to offer the healthy food and utility benefit. Now, if not qualified or verified for SSBCI, D-SNP members will still be able to use their over-the-counter credit on approved over-the-counter products and new for 2026, wellness support products. These are going to be items like fitness items or assistance through the Helper Bees for in-home services, weight management counseling, and caregiver relief. It's important to note that members who don't qualify for SSBCI will not be disenrolled from their plan. Now, knowing that a small number of members may not necessarily qualify for the healthy food and utilities, we've added some new ways for members to maximize their monthly credit. And up here, there's a nice diagram of 2025 versus 2026 when it comes to those D-SNP plans and what may be eligible to use those OTC credits on. So here we can see in 2025, all members had access to OTC, and the same goes for 2026 when they are enrolled in a D-SNP. What's new here in 2026 is this wellness support. So it's not something that was part of our D-SNP plans back in 2025, but 100% of D-SNP members will now have access to use their credit toward wellness support items. Another change that you'll see here is in 2025, under the VBID model, anyone that was on a D-SNP would automatically get those healthy food and home utilities. For 2026, members will need to qualify for SSBCI in order to use that monthly credit toward their healthy food and home utilities. So I've been talking about eligible qualifying conditions. And up here we have a list of UnitedHealthcare SSBCI qualifying conditions. You'll notice many of these are some common conditions that you probably encounter with many folks out there when you're meeting in your conversations. Now, we do have a downloadable version of this list, and that's available as part of our 2026 SSBCI Quick Reference Guide, which can be found in Jarvis. There's also information available about SSBCI and conditions out on cms.gov. Now, when it comes to your enrollments, when you're completing that enrollment, if you aren't sure if a condition qualifies, you might have the consumer or member self-indicate and then allow UnitedHealthcare to take it from there and confirm. We're going to talk about that self-indication process when we get more into the enrollment process here today. So let's dig in a little deeper here to WISP support. All D-SNP members, regardless of their SSBCI status, will get their plan's full OTC credit each month, and they'll be able to spend it on OTC items and wellness support items. Wellness includes aging in place services and select fitness items. We're partnering with the Helper Bees to provide aging in place services. These services include in-home services, such as in-home activities of daily, which would include light housekeeping, like cleaning, laundry, and assistance with bathing and dressing. Weight management counseling, nutritional assessment and coaching to support weight management goals, and caregiver relief. That's temporary relief for their primary caregiver, including things like companionship with daily living tasks and light housekeeping. Through the Helper Bees, members can also select aging in place items such as drains and home and bath safety, and can purchase select fitness items, things like fitness machines and activity trackers, on the member website, or they can contact us over the phone by customer service and place their order over the phone. Switching over now to talk a bit about prescription costs when it comes to the dual population. I think we all know that dual eligibles are under financial constraints. Almost all individuals with full dual eligibility qualify for the Extra Help program known as Low Income Subsidy. And that means that members will continue to pay low copay that aligns with their level of extra help. So depending on where they fall with their level of extra help, and depending on the type of medication that they're filling, whether it's a tier or a brand, they may pay copays anywhere from $0 up to $12.65. Again, it's going to vary based off of their level of extra help or low income subsidy assistance that they receive. Now, for all of our Medicare Advantage plans with UnitedHealthcare, including our D-SNPs, once a member's plan coverage starts, members can start using their U-Card immediately to go see a provider or fill up a prescription. However, U-Card activation is required in order to use the card for things like purchasing their OTC products or spending it on healthy foods or utilities. Now, there are 3 easy ways that they can activate their U-Card. The first one shown here is by scanning the QR code that's provided when they receive their U-Card mailing kit. So they can use their phone or a tablet, scan that QR code, and then go through the process to activate the card. The second option here in the middle is that they can visit activate.uhc.com. This is a UnitedHealthcare activation landing page, and it routes members through a seamless activation process. Option 3, they can call the phone number. There's going to be a sticker on the front of their U-Card. They can call that phone number on the card, and then they're going to have to plug in the number of their U-Card to activate the card. So for new members, you're going to want to prepare them when they're using the U-Card for the first time, and explain that they need to be in a participating store. You and your members will have access to our store locator. For you as agents, the store locator can be found on the home page of Jarvis on the right-hand side under Quick Access. Now, the U card, it's not a credit or a debit card. So that means that your member does not need to create a PIN. But you do want to encourage them to keep their U card in a safe place that's easily accessible all year round. Also, if a consumer needs to get a new card, maybe they damaged it by putting it through the washing machine, just be aware that a new card will also have that activation sticker, and so they would need to go through the activation process for any new card. All right, so we've taken a look at what D-SNP plans are and what may be part of the D-SNP plan for 2026. Now let's talk about what that enrollment process looks like. And there have been some changes with the enrollment when it comes to the introduction of SSBCI. So let's dive a little deeper here into how you can support your members with enrollment and self-indicating if they have a condition that is on our qualifying condition list. Let's say you have a member that is enrolling in a new plan. You want to make sure that you answer the qualifying condition question during plan enrollment. That will initiate the verification process to determine if the member qualifies for SSBCI benefits. When you are using third-party enrollment tools, maybe Sunfire or Connecticut, you are now going to be required to answer questions related to those qualifying conditions. Now, members without a qualifying condition, they may still enroll into a D-SNP. In that case, you would select none of these conditions apply, or I choose not to answer. That will allow you to proceed without naming a provider or providing HIPAA authorization. Now, you do want to make sure to include all of the provider information for the provider, including their name, phone number, and/or fax number if applicable. Over on the right-hand side, for post-enrollment members who have not yet been verified for SSBCI, these might be folks that did not self-indicate during their time of enrollment. You can help them by directing them to UnitedHealthcare's mobile app or member website, or they can reach out to customer service with the phone number on the back of their member ID card. They can self-indicate a condition by going online through the portal or by calling our customer service. Now, for both of these pathways, you as the agent will be able to check your Jarvis Book of Business with member verification status updates, and members can also check that update online as well. Let's go through a journey of a member who self-indicates during enrollment. So here we have a D-SNP enrollment, and the member self-indicates a condition at the time of enrollment. We will verify their qualifying condition using internal data if it's available. If not, we'll reach out to their chosen provider. From there, the member is going to have a 60-day grace period from their plan's effective date, where they can use their monthly credit toward healthy food and utilities. So that's called an access period, sometimes referred to as a grace period. Their plan becomes effective and they have a 60-day access period to use their credits toward healthy food and utilities while we work on that verification of their SSBCI status. Now, members are going to receive their status tracking reminders and updates if they're using the member portal. Again, as an agent, you can track that status in your book of business as well. If the member is verified, they're going to receive a confirmation letter, and they continue to have access to those healthy food and utilities. If the member is not eligible for SSBCI, or if we were not able to verify, they will receive a letter as well, and they will stay enrolled in the plan. However, after the 60 days, they will no longer have access to healthy food and utilities. Again, keep in mind the member stays enrolled in the plan, and they can continue to spend their credits on OTC and other wellness support options. The credit amount does not change based on SSBCI verification. And if we are able to verify a condition at a later time, access to healthy foods and utilities could be restored. Jarvis Enroll is our electronic application tool at UnitedHealthcare, which allows you to enroll consumers in UnitedHealthcare plans. For D-SNP enrollment applications, there will be a required field for the consumer's Medicaid number. You will not be able to proceed forward in Jarvis Enroll until you enter the Medicaid number in the Medicaid ID number field. Keep in mind, if you do choose to use Jarvis Enroll, you'll also have the option to change the view over to Spanish for your enrollment when you start that new application. And for a closer look at those conditions and what you're going to find within the enrollment application, this is an example of what you would see if you're using Jarvis Enroll. Now, for in-person and remote signatures, there's going to be a list of qualifying conditions added to the questionnaire page. There will also be a release of information, which can be filled out so that UnitedHealthcare can contact the provider they listed on the questionnaire page. If you happen to be doing a remote signature in Jarvis Enroll, the release of information will appear after the application has been signed by the consumer. Keep in mind, when you're listing the treating physician, it should be a physician that can confirm the condition that they've listed on the questionnaire page. Now again, if you are using third-party enrollment tools, you will still need to answer the same questions. Just be aware that they may appear in different locations within the enrollment application. So let's put all of this together with a little bit of the new member journey that's enrolling into a D-SNP plan. You can think of the solid blue line as your steps as the agent, and then the dotted blue line is going to take us through that SSBCI verification process. So first we've got a member, they enroll into a D-SNP, and at that time of enrollment, they self-indicate a chronic condition, and they complete all digital forms, and we get that HIPAA consent. From there, they're going to get a notification once their application has been received. Now, once they're pre-effective, the verification process for SSBCI, it can start as early as that pre-effective date. During this pre-effective time, the member can access the member site and mobile app. Then we see that the application is approved and the new member receives their welcome materials. During this time, we're going to start provider outreach to verify the chronic condition. The member will continue to learn about their OTC, healthy food, and utilities benefit and how to use it. Plus, they'll be provided with information about the SSBCI tracker. Then we see that the plan becomes effective. Once the plan starts, the member will have that 60-day grace period for SSBCI benefits. They will have access to healthy food and benefits for 60 days. You will be able to track the verification in your book of business. The member will also receive SSBCI status updates, and providers will receive nudges to verify. A letter will be sent to the member if they could be verified, or if we were unable to verify SSBCI benefit. Let's say in this scenario, the member was not verified. What that would mean is that once the 60-day grace period ends, the member would no longer have access to healthy food and utilities. But remember, the member will stay enrolled in the plan and they can continue to use their benefit credits toward OTC products and wellness benefits. Keep in mind that we do offer additional support with things like rewards, discounts, the OTC benefit, fitness programs, as well as that new wellness support. Now, after the enrollment, you do have the ability to complete the health assessment with the member. Now, a health assessment has anywhere between 20 to 30 questions that can help the health plan identify programs and resources that fit the member's needs. By completing an HA, the member will receive a care plan with goals that are based on their answers and responses. This is completely optional for you to complete with the member. Based on responses, information could be shared with the member's care team. Answering the questions, it will not affect the member's plan, enrollment, or benefits. Now in 2026, UnitedHealthcare will continue to pay for health assessment completions for our dual and chronic plans. And for compensation details, I'm going to turn that over to Natalie if she wants to just chime in here a little bit about those compensation details with the health assessment.
Sure. Hi, everyone. It's Natalie Araniti. I'm the manager here in Connecticut North, and my counterpart Bonnie's on the line too. We'll speak more later. We are focused in Connecticut, so I can only speak to Connecticut for the HA, but I would look on your CIRCON account with us, or call our producer help desk or your upline to get health assessment compensations for other states. But for Connecticut, it remains $50 on all three plans, and that will be paid the end of the month after the effective date. So if you're writing business right now for April the 1st, you'll be compensated that $50 per app the end of May, and so on and so forth throughout the year. So I just wanted to let you know that. Thanks, Jess. Back to you.
Yeah, thanks, Natalie. All right, so now that we have an understanding of what a D-SNP plan is and how that enrollment process works, let's take a look at some different strategies for outreach in your local market. One location you may want to consider partnering with are going to be local food banks. These are distribution centers for free food to low-income individuals. Those are going to include places like food pantries, soup kitchens, and shelters. Every food bank may work a little different. For example, some may offer boxes of food on a daily basis, whereas others may offer food on a weekly or monthly basis. It can be helpful to check out the schedules and coordinate with the staff if possible when it comes to hosting events. If you're looking for local food banks in your area, you may want to jot this down. Foodpantries.org can be a really helpful website where it can help you locate some of the local food banks in your area. Also consider outreach to low-income housing communities. Sometimes these are referred to as affordable housing for individuals or families with low incomes. You can do a quick online search for what affordable housing communities are near you. Also, lowincomehousing.us I have found to be a pretty helpful site. If you go in there and then enter in your zip code, you're going to be able to find areas and locations that provide affordable housing in your market. And also think about nonprofit organizations in your local market that are dedicated to fight poverty. You may start working with your local schools, touch base with religious organizations, or even places like Habitat for Humanity. If you visit communityactionpartnership.com, that is a location where you can find some community-based nonprofits to work with in your market. And here are some other locations you can think about when it comes to building that outreach plan. All right, so now we're going to head over and we're going to talk about some tools and resources that can assist you in supporting the dual eligible consumer. One of the really important tools that we have out in Jarvis is our Medicare Medicaid eligibility lookup tool, which allows you to determine Medicare and Medicaid eligibility for consumers and members with increased ease and convenience. In Jarvis, your home page will have a button here where you can click on Search MMV to open up the search tool. The Medicare lookup allows you to confirm your consumer's Part A and Part B status, as well as any low-income subsidy information seen here on the results page. Now, if you're going to do the Medicaid search, you're going to click on Go to Medicaid Eligibility Check, and then you're going to enter in the consumer's Medicaid information. You will need permission from the consumer to verify their Medicaid status. Once you have your results, It allows you to confirm their Medicaid status, their Medicaid level, as well as the plans that are available for enrollment. So you'll see a yes in green if they are eligible for enrollment in that plan, or you will see a no in red, indicating if they are not eligible for that plan. And then it will also give you some information as to why they do not qualify for that specific D-SNP plan. Another tool that can be really helpful is your Jarvis Book of Business. Now, as agents, you can now check for their SSBCI verification status in your Jarvis Book of Business. So to see which one of your consumers are pending verification, if you go to your Book of Business and click on Filters, there's an option in the member status to select some drop downs. You're going to select SSBCI filters and select Apply. From there, here we have the different filters for SSBCI. You'll get different verification statuses. So if you see green, that means that it's been verified. No action is needed. However, you might see something in yellow that says pending verification. It may mean that the member needs to take some action. They may need to reach out to us and self-indicate. You also may have some folks that are not eligible for that SSBCI status. That will show up here in red. Now, we do have some specific resources to help you out when it comes to SSBCI and understanding some of these changes. In 2026, we have our SSBCI Quick Reference Guide. And also in our Book of Business Quick Reference Guide, this will take you through the steps of how you can go through and filter down to review the different status of your D-SNP consumers for SSBCI. All right, so now we're going to transition here over to Connecticut.
Okay, it's Natalie again, and also on the line I have Bonnie Maynard, my partner in crime here in Connecticut. So welcome.
Hello, everybody. Welcome. Hi.
We'll give you all a few minutes. So this is going to be specific to Connecticut and our 3 D-SNP plans. So I'm Natalie Ironiti, and Bonnie and I are going to help you navigate, just the differences between the plans, our Medicare Savings Program versus our full duals, and hopefully walk you through all of that. And then we have some, job aids afterward that we can send out to Serena, so that you'll have them.
Thank you. Thank you. And I just wanted to see before, in case anybody drops, did anybody have questions on that first half? I don't see anything in the question box, so I'm going to assume no. But if you do, type it in there and we will answer that. If you didn't want to stay on through the Connecticut portion, just going to give it a second, Nat.
Sure. That's right. Yeah, that's what I figured you said. I wasn't sure you were coming back.
No, I'm here. I didn't leave you. No, and we don't have any questions, so we're good to keep rolling along. Thank you.
Sounds great. Thanks, Serena.
All right, so I think we first want to just talk a little bit about the SEPs here. So as some of you know, that last year we saw some changes around election periods for duals. Now, those changes included the integration of what's called an integrated care SEP. Now, this is state dependent. Now, for Connecticut markets, there is no integrated care SEP. However, we want to keep other SEPs in mind. So we do offer D-SNPs in Connecticut, which can be sold year-round during the annual enrollment period, Medicare Advantage open enrollment period, you got your IEPs, and you can continue to take advantage of other common SEPs to help members find their right plan option. Now, I recognize that many of you might be selling in other markets as well. So if you're curious about this integrated care SEP and whether or not it applies to where you're selling, we actually have some state-level D-SNP enrollment guides available in Jarvis. These D-SNP guides, it will give you some insight into whether or not the integrated care SEP is applicable to the market and to the plan that you are selling with. So here are just a few examples of special election periods that could apply. Well, when it comes to looking specifically at D-SNP, you might look into consumers who are newly eligible for Medicaid, or even someone that has had a change in their Medicaid status, right? Maybe they moved from one level of Medicaid to another. So these are just some other special election periods to keep in mind when you're selling outside of AEP or MAOEP. You might have folks that have lost coverage from their employer. Maybe they are new to the Connecticut area, they've just moved in, and maybe they have Medicaid. So keep all of these other SEPs in mind when you're selling those D-SNP plans. And now we're going to take a look at a snapshot of the 3 different D-SNP plans in Connecticut. So I'll hand it back over to Natalie.
Right, great. Thanks, Jess. So hello again, everyone. So we have 3 D-SNP plans, and you'll see the first column with the gray, the 062. That is considered our QMB level plan, qualified Medicare beneficiary through the Medicare Savings Program in Connecticut. And this program actually has 3 levels, but only the QMB level, and you can remember it easily because it's the CTQ-001, so QMB level Q-001 lineup, okay? And then we have, and they all start with the H2001 in the series. And then we have 2 choices for our full duals, which are FBDE, full dual beneficiary, Medicare beneficiary, also considered Husky C in Connecticut, Title 19, there's many names, but it's considered a full dual. And there are differences between the 2 plans. One on the end has more OTC, which I'm going to get into in a minute, more OTC, Medicaid dental, whereas if you want a comprehensive plan with a lot of, the most benefits for the member, I would say that first, that S001 plan is more comprehensive. And, as I mentioned, we'll get into that in a moment. Lastly, besides their OTC stipend, make sure that your members aren't leaving any money on the table. We do have rewards for health for things like getting a flu shot, having their wellness exam, staying in contact, socially with a friend. All of these items have a price tag. So some are $5, some are $10. Maybe they exercised and they walked 10,000 steps. That sort of lines up with what Jess talked about earlier with the wellness support items. They're able to purchase some of those trackers and things of that nature with their OTC funds. So make sure they're taking advantage. It's usually $165 annually, but they are test piloting, and it went up $15. There's one more added, what's the word I'm looking for? One more added item that they can get $180 this year. So that's great. And then in addition to all that, we also have our house calls visits, which are conducted by an APRN. So a lot of things that are specific to United, I just like to call out during these calls so we don't, miss anything. So as far as the numbers of qualification for the Medicare Savings Program on the first column, just go back one, Jess, that QMB level. So an individual can qualify for that Medicare Savings Program, making income of $2,807 per month for an individual. And this is, how they file their taxes. Or if they're married filing jointly, $3,806. But as I mentioned, even though the other 2 levels of this Medicare Savings Program can't have a dual if they're not a QMB level, we have 2 other levels, and they do have their Part B paid, so they'll get that money back into their Social Security per month, as well as fixed drug copays. So I just want to call that out. All right, next slide. Thank you, Jess. And as you can see on all of these, it's all zeros, right? So everything is 0, with the exception of if we go to the, third to last, the RX deductible and the tiers. It mentions a deductible. Just so you all know, members do not pay a deductible in Connecticut. It's shown there in case they lose status, but they do not pay that. New this year, depending upon their level, and it could be level 1, 2, or 3, they will have a small copay on levels 1 and 2 of their Medicaid, which will be indicated on their proof of entitlement letter from Medicaid. It'll have their exact copays, if any, And they range in price from $1.60 up to $12.65 from tiers 2 to 5. So we're keeping our tier 1s at 0 on all levels next year, which is great. I mean, this year, I keep saying next year, which is great. And now to get into the meat and potatoes of the plan. So the Quimby plan has preventive dental only, so that's your cleanings, x-rays, and exam twice a year. The first full dual has $2,500 worth of dental, and the S2 has Medicaid dental, and it's $1,000. So what that means is with the UnitedHealthcare dental on the S001, that's why I said it's a little bit more comprehensive. They still have $1,000 in their Husky C Medicaid, but they'd have to go through a Medicaid dentist, which from what I understand, it's a more narrow network. So just be mindful of that. And vision, going back to the QMB, all three are the same. It's $150, and I like to call this out during these meetings. That money is for the frame benefit. We include a standard lens, keyword standard, at 0. So literally, if they find a frame that's $200, they can have a single vision lens, they can have a progressive lens, they can have readers, but they have to make sure it's a standard material. And that's included at 0. So if they bought a $200 frame and they bought, let's just call it readers, they would have to pay $50 out the door for that whole pair of glasses. If they, found a frame, obviously that's less than, $200 and it was $150, they could get that pair of glasses for 0. When they start putting on things like the transition lenses that turn into sunglasses outside, or the blue light tint or yellow tint, those are all upcharges, which we do discount through UnitedHealthcare Vision, but there will be an upcharge for the difference on those. One more call out, always make sure they're using in-network vision providers found on Jarvis homepage under the quick links as well. Hearing aids, it's a little bit different on the Quimby plan versus the other two. So for the Quimby plan, we're giving them an allowance of $1,500 every 2 years through UHC Hearing. They can do uhchearing.com, or they could call our toll-free number through customer service on the back of their ID card to get that started. And that is for the Quimby plan. For the 2 full duals, they give them a $2,200 allowance, which is great. Again, have to stay in network. Make sure they're going through uhchearing.com, or they call the number on the back of their card. They will walk them from soup to nuts. So they'll start them off and they'll say, what is your zip code? Here are some audiologists to have a hearing test. Then they'll take that hearing script. They can call back if they need to UHC Hearing and customer service, and they will give them places that they can go purchase that hearing aid. All right. So it's a very lucrative allotment for those hearing aids, and they can purchase them every couple of years, which is great. So fitness, which is our own wholly owned fitness called Renew Active, is only on the one in the middle, the full dual S001. It's not available on the Q or the S2, but we have been squeaking. So hopefully our wheel will get some oil for next year on that. OTC on the 3 plans, the OTC is $47 per month on the Quimby plan, the Q-001. And that, again, as Jess mentioned, is, the wellness support items, healthy food and utilities, they need to make sure they get the SSBCI to get the other 2 buckets. So they're always going to get the OTC. The only thing they have to qualify on that SSBCI with those chronic conditions is so that they can use those OTC dollars for purchasing healthy foods or paying utilities. So they want to be able to get those 3 buckets. And that's what this is, the CMS directive for all carriers. On the S001, it's $81 per month. And then on the full S2, the secondary choice for the full duals, it's $156 a month. So for example, if you have somebody that has dentures and they don't really need all that dental, then most of them opt for this S2 plan because they want more money in the OTC bucket. And then lastly, we have the mom's meals on all 3 of our plans. And it is 28 meals covered over a 2-week period. Transportation is only on the 2 full duals, and it's through their Medicaid, right? So they'd have to contact in Connecticut DSS, but they do have a transportation provider through their Medicaid. It's not UnitedHealthcare driven. We are in all 8 counties of the state, which is great. So we're easy, and that's, for all of our plans. And Bonnie, I'm going to call out. Did I miss anything that you might want to add on that?
Yeah, we might want to talk about lifemart.com, LIFEMART.com. It's a huge discount program that if you log in with that program, there's additional discounts that you can have. I mean, there's a plethora. There's Uber discounts. You'll be shocked at how many discounts that you can get there. So don't be afraid to log into there. When you log into lifemart.com, it'll change to care.com, but it's the website. You register, and once you register, whatever percentage you get off on anything that you click on will automatically be applied. So just don't forget about that as well. But thanks,
Great.
Nat. Good job, guys.
Great point. Thank you, Bonnie. Yeah, thank you, Jess. And I think, this is our team. Marianne Von Jess is our director. She handles Connecticut, Mass, Rhode Island, New Hampshire, and Maine. And then Bonnie and I share the state, and those are our counties. We have 4 each. So feel free to take a snapshot of that if you need our phone numbers. Mine, you can text me anytime. That phone number is personal and work, so it's with us 24/7, as Bonnie and I chuckle about. But we truly do respond very fast, and are happy to help you in anything you need. And I'll just turn it back over to Jess. I wasn't sure if you wanted to wrap it up, and yep, go ahead.
Yeah. One other call out too. I know you have a fabulous team there in Connecticut, but we also have our producer help desk as well. So they are available for, questions if you have any around like certifications, your commissions, if you have any challenges with that Medicare, Medicaid lookup tool, they can also assist with that. So there's a lot of different ways that they can help out. You can either reach them by phone, or they've got the live chat in Jarvis. You can just click to chat to speak with them as well. And with that, I think that wraps us up here. So I want to thank you all for joining in and learning more about UnitedHealthcare D-SNP.
Yes, thanks so much, everyone.
Thank you.
Thanks,
Yep,
Serena.
thank you. And oh, you're welcome. I was gonna say, I don't see anything in the question box. I'll just give it a minute. But with that, I mean, this is concluded. So you'll get the recording of the webinar. That'll go out automatically from the GoTo system, and then we will have this on hand to reference back to if needed. Let's see, yeah, nothing coming in. So I guess we're free to go. Thanks, ladies. I appreciate it, and hope everybody has a good day.
Thanks.
Thank you so much. You as well. Take care, everyone. Call us if you need anything.
Will do.